Okay, do we have our virtual colleagues with us? We good? I don't know if he was pointing or putting his thumbs up. Okay, so we will start in the room just in case. I'm not sure if we do have our virtual colleagues with us. Are you both mic'd up? Yes.
Yes.
Fabulous. Okay. Jane, I'm going to start with you. Is there a link between patients who have EDS also having OCD, and how about EDS, OCD and autism together?
So I'm not a diagnostician, but there is definitely, with autism, OCD does tend to co-occur. I don't know the statistics. When I say co-occur, it's more likely it can happen. That's what I've seen. I've forgotten the other bit. And EDS, did you say?
Yes, so
OCD.
OCD, EDS and autism, or OCD and just EDS?
Normally, I'd put autism with OCD, but as I said, the EDS is linked to autism, over double, so that sort of all connects. I'm not saying that everybody is autistic who's got EDS or HSD, excuse me, and I'm not saying if you're autistic you've got OCD, but it can co-occur.
Thank you. Dr. Wang, has acupuncture been shown to help patients with HEDS or HSD?
There are a number of wonderful studies that show that alternative interventions can be helpful with some people. And that's the rule of thumb to remember, that we're all unique and individual, and you won't know until you try. And it might change based on the particular condition that you're struggling with at the moment. So just because it didn't work before doesn't mean it won't work now. And because it didn't work for someone else doesn't mean it won't work for you.
Thank you. Jane, what connections have been confirmed by scientific research between autism and EDS?
So the one I related to before from Dr. Eccles is there, but there are others in the references by Söderloff, a Swedish large population study was 7.4 relative risk. And there's more and more studies with neurodivergence or anxiety and things like fibromyalgia and chronic fatigue. So I've got all those diagnoses before I had my HEDS one. I had the fibro and the chronic fatigue and the, I've forgotten the other one. But there's more coming, but there needs to be much more.
Thank you. Dr. Wang, how does one of us with strong guarded postures and habits of bracing approach these exercises most effectively?
Yeah, wonderful question. So I encourage you to work one-on-one with the yoga therapist who will work with your individual needs. Vini Yoga is the type or label for this approach. And when working with a yoga therapist, they will work with these individual differences in your body to help with your unique needs and have a unique goal for you.
Thank you. Jane, do you think there could be a link between mothers with EDS and having an autistic child?
Yes. I think there can be. I'm not saying that everybody is, but when I put these issues and these symptoms that we seem to have, obviously children, particularly males, are usually diagnosed much earlier because they're more active, it's more obvious. They are neurodivergent. They're spinning the wheels, are hyperactive. Males tend to be quite overt in their presentation. And a lot of people say girls mask. I think it's stereotypical bias on that front and historical bias and research bias. I'm not saying everybody with EDS has it. You might have traits, and that's great, well done. But you might not have a diagnosis, but it might just make sense of your life. You know, maybe you haven't been fitting in. Maybe you felt like you're trying to exist. Maybe you have certain issues, you have certain patterns and routines that you like to do all the time. And you might want to look at that. I find it really fascinating.
Thank you. Dr. Wang, this came in for Dr. Brito, but unfortunately she can't join us, so wondering if you could give a stab at it. How can I help my child mentally process and deal with chronic pain?
Yeah, wonderful question. It's heartbreaking to watch your child go through this. One of the things that I highly recommend is to give your child tools on how to deal with their acute increases and their baseline. What are the everyday self-care tasks that your child and you can do together to help mitigate this pain that will not go away, or if it's intermittent, knowing when it comes back, when it doesn't, and then having the tools in place to deal with acute increases in the pain levels.
Thank you. Jane, what is the best way to approach jobs and life responsibilities when you have a combination of autism, ADHD, dyspraxia, and maybe EDS and HSD? How can you avoid burnout and explain how these work in tandem to others?
Well, I kind of failed at that, but I think life is a process. You're not going to come to the end. We've got to have the good life. I think you mentioned that earlier. I believe very much in Carl Rogers, and I don't want to be happy, sorry about that, but I just like the process of being our authentic selves. Now let's get back to the question, which I've forgotten.
And it's been deleted. What is the best way to approach jobs and life responsibilities when you have a combination of autism, ADHD, dyspraxia, and EDS or HSD? How can you avoid burnout and explain how these work in tandem to others?
I think we all know pacing. Do we all do it? Probably not. I think if you're ADHD, you get a real joy of pushing yourself, hyper-focus, you do everything really up to the limit, and then you crash. So you have to learn to pace, and I think that comes with experience and knowing that if you do crash afterwards, this is what's going to happen. And also we get lows and highs in our emotion, and accepting that's just who we are, and that's really key. You can go for diagnosis, you can tell your employer these are the adjustments you need. I've done quite a lot in employment. I can tell you it's really tricky because it's not about getting a job, it's about staying in employment. And when they have new management or middle managers and they don't know what the board have agreed, it's quite tricky. So it's an ongoing process. It's a two-way thing. It's not just on you, it should be on the employer. We have such skills and expertise. Everybody should want us. Sorry.
Absolutely. Dr. Wang, what are your opinions on dry needling?
So just depends on how it's used as a tool. And one of the things that I always teach my resident physicians in training is we can have a full tool bag, but what's important is the correct application at the correct time for the right patient. So wonderful tool, just have to know when to use it.
Thank you. Jane, is there a link between having long COVID and ADHD symptoms? If so, how do I get my GP in the UK to investigate this?
I think, so with ADHD and probably physical health, dysautonomia is key and brain fog. And some of the symptoms felt by people with long COVID seem quite similar to me. They get brain fog, they seem to have, some have POTS, they get extreme fatigue. So yes, I think there is an issue and maybe it exacerbates it. I don't know of research, there might be research on that. But I think that would be a fair explanation of why it seems more prevalent and it seems to carry on with long COVID, because we're quite inflamed already, I presume, and maybe that just carries on.
Thank you. And Dr. Wang, the last question is, are there any tips on how to reconnect with our bodies without making pain worse when our default mode is disassociated? I find it's a not so healthy superpower sometimes.
You know, it's a mixed bag. Sometimes disassociation is great, and it's what level of engagement are you ready for? And that's one of the most wonderful aspects of yoga when done in this traditional manner, is really noticing where you're willing to go. Noticing that at this point, I want to disassociate, and being okay with that. And then figuring out maybe tomorrow I can do a little bit better, or maybe tomorrow I've used up all my spoons and I haven't properly managed and paced my day. And so today I need to dissociate a little bit more, and being okay with that. And seeing where things go in that toolbox that we would give our child too, just noticing where we are today and noticing where it's going and being okay with where we are.
Perfect. Thank you so much to the last speakers of the day.